From the station that's on your side, this is Channel 7 News Daybreak.
Welcome back. We're entering March and spring is just around the corner, and already trees and flowers are blooming. And joining us this morning with suggestions on how to prevent seasonal allergy flare-ups is Baptist Health's Dr. Devon Ballard with Sherwood Family Medical Center. Thanks so much for being here.
Yep.
This is so timely and affects so many people,
Correct.
especially here in our state. So let's get started. If you have or suffer from allergies, what's the one thing you can start doing now to prepare?
So Little Rock's actually one of the worst cities in the United States for allergies. Actually, we're always ranked in the top 25. So the parts per million of these things in the air are just massive. You can't get away from it. So a lot of people will have seasonal variants where you'll know that, hey, every February, March, April, May, or if you're fall, it's September, October. If you know that you have symptoms a certain time of the year, get ahead of it. Start taking something. Let's say you start having symptoms mostly in March. Then the middle of February, start taking something every day, like stuff over the counter, as we have Zyrtec, Xyzal, which is oral antihistamines.
Okay.
There's nasal sprays. This is a nasal steroid called Runacort, but there's Flonase, Nasonex, which are steroid nasal sprays. There's actually antihistamine nasal sprays, and there's actually nasal sprays that have a combination of both.
And is it just a trial and error, or how do you know which one is right for you?
You got to figure out what works for you, because there's so many different options. There's Claritin, Allegra, Zyrtec, Xyzal. Some people just do Benadryl at nighttime, which may help them sleep a little bit better. But taking it daily for a few months, and then you do a trial off and say, okay, I think I'm good, I'm gonna stop it, and then see if symptoms recur.
Okay, and then what are some other things that we can do to limit our exposure to allergens?
So remember in the old days, people used to hang stuff on the clothes hangers outside, the sheets and stuff. So think about when you wash your car in the middle of April, and go wipe your hand across your car about an hour later with a white glove. There's pollen on it. So what do you think happens to the sheets and stuff hanging outside? Pollen accumulates in those areas. Also, if you're gonna have what I call a super exposure, aka I'm going to go mow the lawn, I'm going to go weed eat, I'm going to go rake, I'm going to blow out the garage, just wear a mask so you have less stuff that you're inhaling because you're stirring it up directly, and your hands. So a lot of people, they're doing weed eating and they're doing lawn work and all that stuff, and you start sweating. What do you do when you sweat? You usually wipe your face, right? What's on your hand? Massive amounts of pollen and antigens that can get into your eyes. A lot of people will have, my eyes are itching real bad. What'd you do the last couple of days? I was outside working. Well, so wear gloves, or take the gloves off, or have a handkerchief inside the pocket where you can pull out and then wipe your face if you need to.
Makes sense. And then shower pretty much immediately after you get done with that stuff.
Because it's in your hair, it's on your skin, so they can get, think of it if in your hair. I have less hair than most, but if you have a lot of hair, then it can get into it'll accumulate on the bed and the sheets and the pillows, and you'll get exposed to it every day, especially if you turn around and now you're getting an eye exposure to pollen that's on a bed because you didn't wash the hair before you got in the bed.
Great advice and things that you may not have even thought of, but start now with those medications if you typically suffer from seasonal allergies, and it can be brutal for many of us. If you have any questions, you can always call the Baptist Health Helpline at 1-888-BAPTIST. Dr. Ballard, thanks so much for being here this morning.